Good afternoon and welcome to the Resolve to be Ready 10 Steps to Preparedness webinar series. My name is Allison Albright and I'm the Regional Preparedness Liaison for FEMA Region 2. I'm going to provide a few technical considerations before we begin. Today's proceedings are being recorded and captioned. The archived event will be available on the FEMA website in the coming weeks. You should hear audio through your computer speakers, so please ensure that your volume is turned up so you may hear the proceedings accordingly. In the top right of the screen, we ask if you'd like to receive news and updates from Region 2. If so, please enter your email address and we'll be sure to add you to the distribution list. We will have a question and answer session after the presentation concludes. You'll see a Q&A pod in the lower right-hand corner. Please feel free to submit your questions about the subject matter there, and time permitting, we'll do our best to answer them. Finally, the PowerPoint presentation from today will be available for you to download in the file share pod as a PDF. You can click on the file and download it using the download button. With that, I'd like to turn it over to the Region 2 Community Preparedness Officer to introduce our speakers and today's proceedings.
Thanks, Allison. Good afternoon, everyone. I'm Debbie Costa, the Community Preparedness Officer for FEMA Region 2. I'd like to again welcome you to our Resolve to be Ready 10 Steps to Preparedness webinar series. FEMA individual and community preparedness programs from around the nation have come together as one FEMA to collaborate on a series of preparedness webinars for our stakeholders. Resolve to be Ready is focused on sharing emerging trends and resources from across the country. Each session will feature FEMA preparedness staff from the different regional offices, and we're pleased to be co-hosting today's webinar with the individual and community preparedness team from FEMA's Region 7 office serving Iowa, Kansas, Missouri, and Nebraska. As we have seen over the past year, the COVID-19 pandemic has had a major impact on colleges and universities. This webinar will walk you through a toolkit which provides important information and an isolation quarantine plan template so that students can be better prepared should they be exposed to COVID-19. We have three excellent speakers today, beginning with Linda Davis. She is the Community Preparedness Officer for FEMA Region 7. She began her career with FEMA in 2006 after 7 years of serving as the University of Kansas Fire Service Training Institute's training coordinator. Throughout her nearly 15 years at FEMA, Linda's responsibilities have focused on enhancing relationships to improve FEMA's mission of helping people before, during, and after disasters. In 2019, she became the Community Preparedness Officer for FEMA Region 7, where she collaborates with regional preparedness partners to promote a culture of preparedness and create more resilient communities. Our next speaker, Barb Sterner, is an External Affairs Specialist for FEMA Region 7 and has been since 2010. She splits her time between deploying as an External Affairs Officer for regional and national disasters and studying, documenting long-term recovery projects from previous disasters. She has been a part of the region's COVID-19 response since March 2020 and currently co-chairs a joint FEMA HHS Schools Task Force. Our upcoming major project is documenting the 10-year recovery of the Joplin, Missouri tornado, which will be recognized this May. Dan Houlihan is the Regional Emergency Coordinator, AFER, U.S. Department of Health and Human Services. Dan's work for HHS has covered a wide subject area. In addition to his work in disaster preparedness, response, and recovery, has an extensive background in federal-level human services and social services programming. Dan's 20-plus years in HHS has had a focused emphasis of working on behalf of children, individuals, and families, especially families and individuals in need. His response and recovery leadership roles as advocate and coalition builder to bring services and support to vulnerable populations disproportionately affected by disasters has led to his current role as the ASPR Region 7 Regional Emergency Coordinator. With that, I'd like to turn it over to Linda Davis. Linda? Linda, if you are speaking, you are on mute. And yes, I was.
Thanks, Debbie, and thank you to everyone joining in the webinar today as we share with you the toolkit that we created as part of a collaborative effort between FEMA Region 7 and the Department of Health and Human Services Region 7. What started out as a few brainstorming sessions between colleagues has grown into a regional schools task force that meets weekly to discuss ways that we can continue to support the efforts of colleges and universities by providing them with high-quality, well-researched information and resources to address COVID-19 concerns on campus. Our presentation today is designed to give you an overview of the first product that was developed by the task force, the Be COVID Prepared Toolkit. Today we want to provide you with some background on our task force. We'll go a little deeper on who makes up the task force and their roles. We'll also share with you the different components of the first product that come from the task force, the Be COVID Prepared Toolkit. You're able to download the toolkit and follow along if you like. You can see that in the documents able to download now. And we're going to talk about the different parts and how they can be used by colleges and universities. We also want to share with you our distribution model. That is, what we did to identify which schools to target for distribution and how we followed up. Finally, we'll share with you our next steps as a task force, both in terms of the Be COVID Prepared Toolkit and other initiatives we've identified that can assist colleges and universities. Now I'd like to turn it over to Barb Sterner, who will provide some background information on the Region 7 Schools Task Force.
Hey, good morning, everyone. This is Barb Sterner. I'm an External Affairs Specialist with Region 7. Moving on to the next slide on the background, I wanted to talk a little bit about how we got started with this toolkit. We saw this need when we started to see a spike in cases on the college and university campuses in Region 7 around Labor Day weekend. And it really concerned us. We were trying to figure out what's happening, why are we seeing this? And so we looked at, we decided to do kind of a surveillance of our major colleges and universities, both public, private, and then some of our community colleges as well. So we surveyed their websites and to look at what information was out there and was there anything that we could add to the conversation. What we found is that many of our schools had specific COVID resource pages. They were very well done, but we learned that we started to notice a gap, which was that there didn't seem to be anything on the public-facing information that addressed what students should do if they came down with a COVID diagnosis or an exposure. We did see among a lot of our schools that they had set aside isolation and quarantine housing. So we knew that there was some kind of a plan, but we weren't seeing the information piece of that, nor were we seeing any kind of a plan template. So we decided that's what we wanted to focus on, was trying to help provide information about educating students and faculty and staff about what to do if you test positive or exposed. Next slide, please. So we put together a team, a joint team with FEMA and HHS. Our team on the FEMA side, we pulled together external affairs, long-term recovery person from our recovery division, and our national preparedness team, Linda and Ryan. The good thing about the way we did that, as it's turned out, is that it's really given us a great mix of expertise and perspectives and skills. So we had a lot of resources among us to deal with the FEMA side of that. And Danny, would you mind addressing the HHS side for us?
Sure. Good afternoon. Good morning, everyone. Dan Houlihan here. The HHS side of the task force, we had the ESF-8 Health and Medical Response Group. That's the group I represent. And we had ASPR Recovery from Central Office, Washington, D.C. Before we go on, I think it's very important to mention that the relationship between FEMA and HHS in Region 7 is hand in glove. The overall response to COVID has been a true joint mission in this region. We routinely meet together, and I think with respect to this toolkit, the nuance that both groups brought forward really made this toolkit what it is. And lastly, I want to say that the regional leadership, both HHS and FEMA, once we started talking about this, were all in. And so it really lent to our ability to move forward, reach out, and develop this toolkit. Barb, back to you. Oh, sorry, that's me. Let me talk about why we did this toolkit and some justifications. The slide before you shows the prevalence of disease burden within different age groups. The number one age group, 18 to 24-year-olds, had the highest disease prevalence, positivity rate, or disease burden, whatever you want to call it. That's the dotted line. The second highest was the 25 to 44-year-old. That's the long dash dotted line. So this was from March 1st through November 14th of 2020, this slide is. And I would surmise that the stats are very similar to this, if not the same. Now, even though the 18 to 24-year-olds had the highest disease prevalence, that's not to say that they had the highest severity or outcome. As we all know, our senior population and individuals with comorbidity fell into that category. Next slide.
Thanks, Danny. So why did we do a toolkit? Well, originally, our idea was to survey and look for government-vetted resources that we could provide at colleges and universities. So we jumped on the CDC page right away, which if you have not ever been there, I really recommend that you go there because there are a ton of resources, a lot of graphics, you know, easy one-pagers. And so we all searched a whole bunch of websites and came up with our a lot of documents. We decided to narrow it to 10, and we said, okay, this is what we want to send to everybody. When we got ready to do that, it suddenly occurred to us, well, we have to figure out a way to tie this together. Like, we have to tell them something about why we're giving them these documents and what they should do with it. So that's really how the toolkit that you're seeing now was born. We wanted to provide clear, actionable messaging. We wanted to tie those pieces together, and that's really what led us to say we're going to need to write some overarching kind of documents. So we started writing. Our goals here were to be accurate, concise, to use a thought-provoking format that would actually pose questions for students so that they could do their own self-assessment and then recommend solutions to them for these questions. And then we also wanted to make it sort of visually interesting, easy to get through because we were presenting a lot of information. And we wanted to be very careful not to provide any guidance that would conflict with what colleges and universities were already recommending to their students, because everybody was handling it a little differently, and we didn't want to supersede that or conflict with that. At the time that we developed this, which was October of last year, you know, there was just such an information overload in the public space about COVID, wearing masks, practicing physical distancing. And so that was our biggest challenge, was how do we share what we need to tell them, but in a way where they won't, like, stop reading after page 1. So we came up with a main document, which is all of the information material. And then we decided, since we were recommending that they make their own plan, we started to try to look for templates that we could provide, and we couldn't find anything. We even looked at universities outside of the Region 7 states, and we just didn't see anything that it currently existed. So we made our own template of a plan that matches the main document of the toolkit, so that a student could say, it was almost like a checklist and a written document or typed document that could sort of keep them on track, guide them through all the steps we wanted them to go through to get ready, and give them something to give to somebody else, like parents, friends, spouses, so that someone else knew what their plan was going to be. And then, again, we included the HHS, CDC infographics so that the universities and colleges would have some documents that were all ready to go. They could post them right on their website, and it could either go along with the plan or be instead of the plan, depending on what fit their needs. Next slide. So we developed 3 key principles with the main audience being geared to students. The first one was, let's prevent this to begin with. And some of the feedback that we got from our informal focus group was like, we're tired of hearing this, it's too much information. So we really sort of shortened that to just say, look, you've got to do these things. You've got to wear a mask, you've got to social distance, wash your hands. The second piece of it, which was the main focus that we wanted to provide, was to prepare them. So what are the things that you would need to accomplish this end goal? We split that into 3 sections. Have a plan, make a kit, and aim to sustain. A couple things I'll say about that. The plan, I've already talked about that a little bit. Make a kit, we actually developed our own checklist for that because there were certain things that were COVID specific, like we want you to add gloves, we would like you to add masks, have some hand sanitizer.